Well, hello everyone. This is Dr. Alan Weinstein for About Real Health, creating a new health culture worldwide. I'm your host for today's show, and today I have a very special guest with me, Dr. Charles Majors. He has a fascinating story, and I think one that you're really going to find of great interest, and some of the things he's going to bring to the table are going to amaze you, and his story is nothing short of amazing in its own right. About Real Health is about real health success stories, and so that you can learn that real health is possible. Today's guest, Dr. Charles Majors, is a chiropractor, and one of the things he says is getting to the cause is the only cure. In September 2010, Dr. Majors was diagnosed with an incurable bone marrow cancer that metastasized to his brain. He's going to talk about that experience. He's going to talk about what he did, and he's going to talk about what he's learned through that experience and how he helps people deal with these type of challenges. He's the co-author of two books, one called Maximize Living Makeover and the other one, Cruise Ship or Nursing Home. You could learn more about Dr. Majors at his website, www.beacancerkiller.com. Dr. Majors, the screen is on you, and I want to welcome you to our show.
Well, thanks. We better get started because it's gonna go fast, and it's gonna take a while probably. So well, I know you want to hear a little bit about my story first.
Yep.
Awesome. Okay, so probably around, it'd be years ago now, but probably about 6 to 8 months, I was having some severe headaches, and as a chiropractor, you know, obviously I was doing everything I thought was right. I was getting adjusted. I was, you know, doing the nutrition and the supplements, everything that I thought I knew was the right way to go. I still get headaches. Started getting some blood work done. They weren't finding too many things. It was some areas were off, some areas were on, so they didn't think anything of it. And I was going to some friends who knew how to do blood work. So then finally, the headaches had gotten worse. I couldn't get up, couldn't practice anymore. Couldn't hang out with the family, couldn't do anything. I would sleep anywhere between 16 to 18 hours a day. I'd be in bed and barely get up. When I'd get up, I'd fall back down. So finally, I knew it was time for an MRI. I went in around 3 o'clock in the afternoon, 3:30, to get an MRI. They told me they'd let me know the next day at what the results were. We got a call around 5:30. I was sleeping again, and my wife and my older son woke me up crying, and my wife said, you know, we have to rush to Northwestern Hospital immediately. They already set up an appointment with a neurosurgeon there. It wasn't something simple. You have 4 tumors in the brain that are crushing your spinal cord. They need you there immediately. To them, the radiologist who read it said it was life or death. So they literally called me within an hour and a half after they read the x-rays or the MRIs. So we obviously got into the car. Loaded up the kids, went to Northwestern. I got inside of there. They put me into a room, rushed me into there. My mother had met us there at that time. They told my mom, they told my wife, they said, get out of the room. You don't want to see what's going to happen. And at that point, they took a drilled down right here in my head to put a tube to start releasing the spinal fluid that was being blocked the whole time. So what was causing the headaches is the tumors were pushing on the spinal cord, not allowing the spinal fluid to be able to flow down. So when I laid down to rest, I obviously wasn't building up as much. And then when I got up, all the pressure would build up in my head over time.
So it was swelling the brain. Actually, the fluid not being able to come down was just swelling in the brain. Yes? Yes.
And it's a great metaphor for chiropractic, because when there's pressure on the spinal cord, whether it's coming from the bone, you know, creating damage or creating an inflammatory reaction in that area, or creating from a tumor, your brain can't get to the body, you don't heal, nothing functions well. I mean, my body was shutting down. So they put the tube down my head to drain the fluid out, and immediately I probably felt better for the first time in 6 months. So thank God for medicine and crisis care at that point, and that's what they're great for. And so then they said the neurosurgeon will be in the morning, and he would be able to determine what's going to happen next. Next day, neurosurgeon came in, looked at the MRIs, looked at everything, and said, "You're young, you're healthy." Obviously didn't look at my blood work either, but young, you're healthy. We're just going to go in there. It's going to be about 4 or 5 days of preparation for brain surgery. We're going to go inside of there. And they went in right here, if you can see the scar. They went up inside the brain there about a week later. And he said it'd be anywhere between 8 to 10 to 12-hour surgery. He got up there, and he cut on the first tumor, and it started bleeding all over the brain. So he got out of there immediately, and he realized, oh, no, this wasn't benign, that this is cancer. Worse than that, I cut on it, which it creates, and anytime you cut on something, you create an inflammatory reaction, so now there's more swelling in the brain, and now the cancer is being spread throughout the brain. He went into the room where my wife, Dr. Ben Lerner, who co-authored my latest book, Cancer Killers, he was in there, all the other doctors waiting and friends, and the neurosurgeon said, the bad news is it was cancer in the brain. Worse than that is I cut on the tumor, and we don't know if he's even going to wake up in the morning. So I was, obviously I don't know what's going on. I don't wake up till the next day. I get up the next day and think everything's okay. I'm thinking, hey, I woke up, I'm alive, I'm safe, all the tumors are gone.
Now, you still had bone marrow cancer here, because that's how it was the metastasis.
Yeah.
We're not even talking about bone marrow cancer yet. We're still talking about the brain.
They didn't know. That was the thing, that they didn't know where it was coming from. They thought it was just, they weren't sure where it was coming from. All they knew was, number one, I have cancer in the brain. Number two is it was swelling. Number three is it was coming from somewhere else and they don't know. So it's kind of three bad news for my family and myself. So finally, probably a day later, the oncologist came in. They come in with a team of people, because at Northwestern is a school. They come in with a bunch of interns, and they sat at the bottom, the bottom of my bed, and they said, the bad news is, this is cancer. Worse than that, it's coming from somewhere in your body. We don't know where it's coming from. We're going to spend the next 3 or 4 days pretty much exploring your whole body, trying to find where the cancer is coming from. So then I went through, you name it, from CAT scans to PET scans to MRIs to all the different types of blood works. They did everything they could to try to locate this cancer. They thought for sure it was metastasized from an organ. They found nothing. The last test they did, finally, they did a bone marrow tap, where they actually literally, they go into your hip where most of your bone marrow is, and they drill into there.
A core sample. They take out the core sample.
It's a core sample. So, and then they pull out the bone marrow. They tested it. 37% of my blood was producing cancer. And so that was when they came up with the diagnosis. They came in the room and they said, unfortunately, this is it's a multiple myeloma, which means my myelocytes were being increased. They said, it's already in your brain. Even if it wasn't in your brain, myeloma is an incurable cancer. There is no cure. So you have an incurable cancer that spread to your brain. I lost 40-some pounds being in the hospital just in those 2.5 weeks. I was in a wheelchair, could barely walk or move. At that point, they said, all we can do at this point is a high-dose chemotherapy, some radiation to minimize the tumor, and we can do a bone marrow transplant. That'll only buy you some time. So I wasn't given much hope at all. But that's when you know that when a doctor says there's no hope, when a doctor says there's no cure, all that means is that his or her knowledge of this is limited, and it's time to go somewhere else for help. And that's when I determined, you know what, I don't need a cure. I want to know what caused this. I remember, and thank God for my chiropractic philosophy here, I said if I cut my arm right now, even as I'm sitting in this hospital right now, even when as I'm laying here right now in this hospital bed, if I cut my arm right now, it's going to heal. So if my brain can heal this cut, it can heal this cancer. That God needs no help healing, no interference. I need to figure out what's healing, what's interfering with this healing. So at that point, a lot of people around me were trying to determine where am I going to go next. they were ready in the hospital to send me over to what's called Prentice, which is the Northwestern's oncology area there, to get ready for a bone marrow transplant. That's what they would do first. Then it would go through chemotherapy. And at that point, we knew it was time to go and get out of there. I knew that you couldn't make me sicker to get me healthier. I was sick. You don't get cancer, then get sick. You've been sick for years.
That's how you got the cancer. Now, can I ask you one question before you go on? Had you already had experience working with cancer patients in your practice?
You know, I would say more than the normal amount of people probably, but still, you know, the knowledge I knew compared to what I know now, I probably knew 5% of what I should know, or 10%. So, you know, so I knew that it was my sickness over time that created my cancer. So if I just got rid of the cancer, even if I did a bone marrow transplant, high dose chemo or anything, that I'm still sick, or even now even much sicker. So we left there. We went to the department, talked to the neurosurgeon, talked to them, and they couldn't keep me there. I'm an adult, but we just said, you know, thank you, but we're out. And I remember him saying that, you know, he said, good luck. He said, I totally understand. All the nurses there understood. They thought they knew I was dead. What's funny is I went there a year later. I went into that hospital a year later because I said I'll be here in a year, and they all said good luck to me, you know, because I was there on my birthday, so I celebrated my birthday at Northwestern. But wow. I said I'll be back here in a year on my birthday, and I was there a year later, and I walked around, talked to the nurses, and they could remember me back then because I was there for so long. And every one of them that we met with said, there was no way we thought you were going to live. Nobody leaves I was in the ICU. Nobody leaves the ICU, goes into full-blown chemotherapy and bone marrow transplant and lives. It just doesn't happen. Most people don't make it even through a bone marrow transplant, let alone when I was coming from an ICU. So at that point, literally I left there 8, 9 in the morning. I was on a plane by 4 o'clock to Reno, Nevada to see Dr. Forsythe, who's a premier oncologist who uses obviously more of a natural approach. He doesn't necessarily get to the cause. That's a confusion most people have with getting to the cause. There's 3 steps that I followed, and step one I had to stop making the cancer first by getting to the cause. This is what I teach in the book. So I had to get to the cause of this and stop making it. I could live another 40, 50 years as long as it never got any bigger or any worse than it was. I was alive. If you're alive and you have cancer, as long as it doesn't get any worse, you can still live another 30 or 40 years. Everybody wants to kill it and get rid of it. That's not even step one. Step one is you got to get to the cause, find out what's interfering with the body that you have the cancer, and now stop that so you can keep living. Step two now is to decide, how do you want to kill this? Some people decide they want to do it through chemotherapy and radiation. Some people decide they want to do it naturally. However they decide to do it, they have to make that decision to do it in a way that's going to work. If somebody decides they're going to, yesterday I met with a woman who actually flew in to see me from Texas, and she decided that I'm going to MD Anderson on Friday, and I have my next chemo round. And that's what she decided to do. So I have to make sure I help her, number one, get to the cause, and then number two, protect herself during all this chemotherapy and radiation. That's her choice. I'm not going to tell her choice is wrong or not. So some people decide I'm going to kill it with IV vitamin C's and ozones and hyperthermias, whatever. Either way, that's still step two. I was in Reno, Nevada for step two. I knew that I needed an IV, what's called IV poly-MVA, which was able to get up into the brain-brain barrier and kill and start to eat away this cancer and start killing some of it. I was doing IV vitamin C, immune therapies, hydrogen peroxides. They were doing homeopathics. They're still treating the cancer. And then in the meantime, I was studying and learning. Probably, I want to say I was reading while I was getting IVs done and everything. I was reading between 6 to 8 hours a day, watching things for another 2 to 3 hours a day. I probably engulfed myself to 12 hours a day just on cancer, trying to figure out what is it, how did this happen, and getting to the cause of that. And so then when I left there, I was only there for 3 weeks. I left there and came back, and that's when I had to begin all the harder protocols. I also had a tube in my stomach, in my in my lower GI there, because I couldn't eat because of the tube they put down my throat. So I had no voice at all for almost a month. So I was being fed through a G tube the whole time.
So now we went through step 1, which is basically stopping the cancer from getting worse. Step 2 is figuring out how to kill it off. And what is step 3? Is there a step 3?
Yeah, so step 3 is you got to rebuild and strengthen the immune system back up, because the reason why you got cancer in the first place is because you had a weak immune system, right? So we look at, everybody has cancer every day. We have anywhere between 1,000 to 10,000 cancer cells growing every day, no matter who you are. But we also have an immune system that's in control of this, that keeps us in balance and keeps it under check. So why does one person have 1,000 cancer cells growing, right, in their body and gets cancer, and somebody else is doing everything wrong and has 10,000? Well, that goes back to the nervous system and chiropractic. But because one person has a stronger immune system, and no matter what they do, they can handle this, and their body can kill all this. So you got to rebuild the immune system back up. And most people are going through, traditional radiation or chemotherapy. It destroys the bone marrow, because chemotherapy kills fast, rapidly growing cells, and some of the fastest, rapidly growing cells of your body is your blood, so your blood cells, your bone marrow. So they have to make sure they're really protecting it. So now they get cancer, they end up with just doing chemotherapy, never getting to the cause. They have no immune system left. They never had an immune system to begin with, and now what comes back in most cases, more cancer comes back. So we got to make sure that we're following all three of those steps. So when it comes to looking at what cancer is or cancer isn't, number one, you have to remember you can't poison yourself back to health. And I realized that being in the hospital, I couldn't get myself back to health by getting myself sicker or using chemicals to get my body back into health. Now, could those things minimize a tumor load and kill it? Absolutely. There are ways to do that. But number one is, to get healthy again, I had to follow the right protocols. Cancer is nothing more than a survival mechanism. It's there to protect you. Every symptom is the body doing the right thing at the right time. And I always explain, if I locked you in your room right now where you're at, I don't let you out of there, and I measure your blood pressure before I let you out of there. I measure your blood pressure, and your blood pressure is good right now. But then all of a sudden I close all the doors, I start a fire in your room you're in, and then I don't let you out of there, and you're about to die, and then I check your blood pressure. Is it going to be higher or lower?
Well, I think from the stress it's going to be higher.
Absolutely. So your blood pressure is higher. The stress is causing your cortisol to raise as a stress hormone. As your cortisol raises, your hormones are a mess.
And it suppresses your immune system again.
It suppresses your immune system. So now all of a sudden, you are a healthy individual, and within 10 minutes you now become a sick individual. Blood tests are off, blood pressure's off. So is that genetic, or are you adapting to the stress I just put you under? You're adapting to the stress.
To the stress, of course.
So every symptom is the body doing the right thing. Why would my blood pressure go up? Why would my cholesterol go up? Why would everything go up? Because they're life-saving mechanisms. It's a fight or flight. My nervous system is increasing. And so why does the blood pressure go up in times of stress? Because the body has to move more blood through the body to heal us. And so why does cholesterol go up? Why? Because our hormones are made out of cholesterol. Sure. So we need cholesterol to make our hormones. So why is it that you look at it, a younger person doesn't have as many cholesterol as an older person? Well, as a man gets older, his hormones go down, and he needs more testosterone. Same with a woman. So there's every symptom is the body doing the right thing at the right time. And cancer is exactly that same exact thing. That it's not genetic. It's not a coincidence you have cancer. It's not unpredictable. It's not bad luck. We caused it. We created it. And as hard as that is for some people to comprehend or get mad at me on that, we know it's not based upon our genes. Our genes are responding to the environment. We're above our genes, epigenetic, based on Bruce Lipton's work and all the new work on genetics. We turn our genes on or off depending on how we live our life. It's our choice how we do that.
Yeah, and that's why you say the only cure for cancer really is never getting it in the first place.
That's the true cure.
Yeah, and so let me ask you this question, though, because in step 3, we talked about really building up the immune system. So I guess for people listening, what role did chiropractic play in building up the immune system?
Well, I mean, there is no question. I mean, we know that based on every study, in order for my immune system to function, in order for my immune system to work, the only way my immune system works is the brain has to send a message down my spinal cord, through my nerves, into my organs. For my heart to beat, for my lungs to breathe, for every function of my body to work, my brain had to get down the spinal cord into my organs. And so that's why is one person, and this is the great part right here, right? So I had a guy who came in with prostate cancer. And he came in and he asked me, he said, what do you think caused this? And I said, well, what do you think caused this? And he said, well, I've been eating bad for years. He said, I've drank for about 5-10 years of my life. He said, I've smoked. I've been stressed. I have a stressful job. And he went through all these reasons why he thought he had cancer. And I said, well, tell me this. If eating bad caused cancer, why doesn't your stomach have cancer? Right? If drinking caused cancer, why doesn't a different organ have it? If stress caused it, why don't you have brain cancer? Right? If not exercising caused it, why don't you have lung cancer? Why do you have cancer in your prostate? So it has nothing to do with all those. Those things contributed. And then I went over right to that chart. I went over right to that chart that a lot of you have in that nervous system. And I came over here and I said, if I cut that nerve right there to your prostate, and you're eating perfect every day, and you're drinking everything and exercising, what still happens to your prostate? He said, my prostate doesn't work. No, it dies. It doesn't matter. But what if I came over here and I instead of cutting the nerve to the prostate, I cut the nerve to your lungs? What happens to your prostate? The answer is nothing. That's right. So if I came over here and put pressure on the nerve to your prostate, how are your lungs going to work? He said, well, my lungs aren't being affected. That's right. So if you're eating well every day and you're exercising every day, right, but there's pressure on this nerve right here going to your prostate, it doesn't matter what you're eating or what you're drinking, your brain can't get there to heal the area. It's our brain, it's communication. For our brain to see the cancer in our prostate, it has to see it. How does the brain see an organ? Through the nerves. How does the brain heal us? Through the nerves. How does the brain take the nutrients and absorb them? Through the nerves. Everything else is secondary from the brain, spinal cord, and nerves. So I knew that without a doubt that even though I was getting adjusted, I wasn't corrected. I wasn't fully being adjusted. I damaged my spine. I'd been bending over. At the time I was seeing thousands of patients a week. So I was bending over, destroying myself from the sports I was doing to everything. I destroyed myself, and I was getting adjusted, but I wasn't getting a corrective care. I wasn't fully clearing my nerve system out, and that was when I literally had my X-rays sent in to Dr. Tony Naldo, who's a expert in the area of corrective work. The way I mean, everybody else has their own way of correcting the spine. This was the way we correct the spine, and I literally began 3-4 days a week back to like a regular patient again. I was doing twice a day, sometimes 5 days a week, until it cleared out. And if most people who've ever seen my talks or seen me do a presentation, you can see my new X-rays compared to when I was diagnosed in 2010 to diagnosed and undiagnosed now. It's completely different. Completely different. My nervous system scanning every other test is completely different than where it was when I went in. So absolutely, the nervous system played, without a doubt, one of the biggest roles.
Yeah, I want to just say something for our listeners. A lot of our listeners who are listening to the show may not know that much about what chiropractors actually do, or they may be new to chiropractic. So what Dr. Majors is talking about here is that what chiropractors do is they are nervous system specialists. They make sure that the function between the brain and the organ, the cells, and the systems of your body is flowing clear. And what happens is you get these interferences that block that, and through the chiropractic adjustment, those interferences are removed so that your nervous system, which is the major controller of all things that keep you alive, and of course the immune system, as we're talking about here, allows that communication to be able to work the way it's designed to do. Some people think all we do as chiropractors is back pain and neck pain, but what we really are functional specialists in terms of the nervous system. That's why when you're hearing now Dr. Majors talk about making sure that he was getting the correction and getting cleared out, not just getting adjusted once in a while, but rather really having his spine worked on, because that houses the nervous system and allows that communication to work, so that he had the greatest likelihood of being able to heal. And of course, here he is. How many years later is it?
Now it's 4.5 years, going to be 5 years in September. It's almost 4.5.
Just absolutely amazing. So let me ask you this, going back to what we said about the cure is really never getting cancer in the first place. For people that are listening, what should be the things that should be in their mind right now based on your experience and the things that you share with both patients that do not have cancer, that are patients of yours that come into the office, and those that come to you as consultations? What are the things they need to be thinking about in their life so that they never do get cancer in the first place?
So as a maximized living doctor, I look at 5 things. So number 1 is, obviously, I'm going to look at the nervous system. Obviously, we can say that. But number 2 is mindset is the key here. So we look at the mindset of the person, where one person has the mindset where they know they're going to make it, the other one's not sure they're going to make it, right? One person comes to me and says, you know what, I don't know what I want to do. I don't know if I want to go through chemotherapy and radiation. I don't know if I want to do it naturally. I'm so confused. I don't know what I want to do. That person usually never makes it, no matter what they decide. Mindset is crucial here. That according to the CDC, and this is the CDC said, intense, prolonged stress leads to a variety of short and long-term negative health effects. It disrupts early brain development, compromises the function of the nervous and immune systems. So literally, what they're saying is it starts here and affects the nervous system as well. High levels of stress, including hormones get raised when you're stressed. Cortisol, which suppresses your immune response. So if somebody's stressed on a regular basis and isn't dealing with that, that affects their immune system. We know that 1 minute of stress can begin to shut down the immune system or decrease it for up to 6 to 8 hours. 1 minute. How do we know that? Because when you stress, we begin to constrict our blood vessels, right? And when we constrict our blood vessels in a protective mode of our body, when you constrict your blood vessels, you're losing blood through there. What does the blood carry? Oxygen. It carries our blood, which is our immune system. It carries nutrients. So when you're stressed, you're beginning to shut down your immune system. You can't carry nutrients. You can't carry oxygen. Well, what does that cause? It's called cancer. So we know that it's that person who is really healthy, supposedly. They go into the doctor just for a checkup, and they're doing great, and then all of a sudden they get diagnosed with cancer, and 6 months later they're dead. Well, how does that happen? Because they didn't know they had cancer, and their immune system was working, let's say here at least, not here it should be, it's working here. All of a sudden they get diagnosed, they have cancer, now their immune system drops to here, and now they die. So mindset is crucial. Also the mindset of, that you're not a victim, you're a victor. It's the mindset I teach in the book that says, no matter what happens, I'm going to reverse this. I don't care what's going on. They told me I had a 1 in a million chance or something. It's never happened. You know what? Then I'll be that 1 in a million. That's the mindset I had, that I will study it, I will figure it out, and I will do whatever it takes. I don't care if I have to spend 12 hours a day, eating a certain way, living a certain way. I don't care what I have to drink, what I have to eat, or what I have to do. I'm going to reverse this. It's the same thing, whether it be in your life, your relationships, your practice, your finances, whatever it is. If you decide I'm going to do whatever it takes, then you will have a greater outcome of success. So mindset is key there. Next thing, obviously, that's preventing it and getting rid of it. The next thing that we always look at is obviously nutrition. Nutrition is key here. I like to look at 3 steps of nutrition that I like to teach, which are simple. I want to keep it simple here. And number 1 is we have to remove the amount of sugars you're eating out of your body. Without a doubt, if you just did one thing today and you just minimize the amount of sugar coming into your body, we know based upon the Department of Oncology Sciences, this is from University of Utah, all these studies are out. They said due to a lack of glucose halts the growth of the tumor cell. This is coming from oncology people saying the lack of glucose halts the growth of the tumor cell. Halts the growth of the tumor cell. The lack of it halts the growth, and that's powerful. So one thing we want to do is we want to do whatever we can to eliminate as much as we can, eliminate the amount of sugar that's going into the body. So we minimize the amount of sugars, whether it be from carbohydrates, because remember, all carbs turn to sugar within 2 to 4 seconds. We look at anything that's going to raise that blood sugar level. Why? Because when sugar goes into your body, it creates a huge cascade of effects. It affects hormones. It goes in and affects your immune system. It feeds the cancers. It feeds viruses. It feeds bacteria. And this inflammatory reaction that it creates is literally the cause of almost every disease process there is. Whether somebody's coming in with aches and pains, whether somebody's coming in with fibromyalgia, whether somebody's coming in with Crohn's and digestive issues, whether somebody's coming in with cancer or heart attacks or diabetes, we look to reducing that inflammatory marker. So we got to eliminate the amount of sugars we're putting in the body. Number 2 is you need to get rid of the bad fats. We know that without a doubt, somebody always says to me, what's worse, the sugars or the bad fats? And I'm pretty close here. I don't know. They're almost a tie. When you bring a bad fat into the body, your
meaning
body,
a trans fat or a hydrogenated fat.
Yeah.
Yep.
Trans fat, and they're being. I mean, most trans fats now are being recalled. I mean, you can't even have them being banned by a lot of the cities that you're going into. That a trans fat takes, probably over between 90 to 100 days, depending on what research you see, to actually break it down and digest it. You can't digest a bad fat. When you bring in a bad fat, the problem is every one of your cells of your body is made of fat. It's a lipid bilayer. So these bad fats cannot get into it. They stick to the outside and begin to inflame the cell. And when it inflames the cell, oxygen can't get in, nutrients can't get in, and bad things can't get out. So the cell becomes congested. It can no longer bring in oxygen. It can no longer bring in nutrients. You leave all the toxins in there, and now it becomes oxygen depleted, and now has to turn into a sugar burner for all its fuel, which is a cancer cell. So without a doubt, if you look at Johanna Budwig's work, all that goes back to the bad fats, the trans fats, and how when we moved into these trans fats, you also saw a high amount of more cancer starting once we started shifting into this trans fat. So changing your bad fats to good fats. Good fats, obviously avocados. Your best oil to cook with is coconut oil. Olive oil is amazing. Don't cook with it because you don't want to heat it too hot. Raw nuts and healthy nuts. If you have an issue with nuts because of the way you break it down or digest it, all you have to do is soak them for 24 hours before you eat them. So there's some amazing fats out there that we get in our body. And then the third thing, I have like 50 steps, but let's just go with 3 here. The number 3 is you've got to change your bad meats, your conventional meats, to healthy meats. Because whatever that cow is eating, you're eating as well. And that's what we forget, whatever that cow is injected with or animal is injected with, you're eating that as well. And so if you're not changing these meats you're eating these conventional meats that are so lacking in the amount of the ratio of good fats. If you look at a grass-fed meat versus a conventional meat, the ratio of omegas, your 3 to 6 ratio is, which obviously should be 2 to 1 to 4 to 1 ratio. You're talking in a conventional meat, 40 to 1 ratios, which is increasing and inflaming your body again. So if people on the line just did one thing right now, people watching said, okay, I'm going to start minimizing the amount of sugars I use in my body. I'm going to start changing the fats, changing my meats, and start putting in some healthy supplements and vegetables. And I like foods more than I like supplements first. So from juicing to smoothies to shakes to doing all that throughout the day. And then bringing all those things in your body, there's no doubt, that you're going to be better off. If you talk about supplements, number 1 supplement, I always tell my patients, if you can't take anything else and you can't afford it, number 1 supplement is vitamin D3. So vitamin D3, without a doubt, is the most researched supplement in the world with cancers and with almost everything. That's where it literally controls your genetic potential. It turns on the P53 gene, which is the actual gene for apoptosis, which actually it shuts the cancer cell, and keeps the cells from dying. So vitamin D3, which not only helps your immune system, it's a hormone. Without a doubt, one of the best things you could ever put into your body. if you couldn't do anything else but change some things, get on a good multivitamin and get on a good D3, you're in the right direction. Let's move into quickly oxygen. Our body needs oxygen, and so we got to be bringing in oxygen. That the old way of stepping on the treadmill and walking for a mile or two or for an hour is we know now, based on all the research on metabolic conditioning, and that's not the best way to work out anymore. That in order to get the best results from a workout, it's all about heart rate. And so you're better off. Go ahead. You shut off. I think did your shut off or mine?
No, you keep going. You're doing fine. You're doing fine.
Good. So when your heart rate is pumping, we now begin to build our hormones back. Our growth hormones are rising. The key is that is not to burn fat when you're working out, because remember, our understanding the principle of how the body works is our body will always move into protective mode. So if I'm burning fat when I work out, then for an hour, it's going to store fat for the next hour, or for the next 23 hours. So I want to make sure I'm not burning fat when I work out. I want to make sure I'm taking it to the point of high intensity, short duration. We teach in the book is we're teaching at a high level where your heart rate up, heart rate down, heart rate up, heart rate down.
Interval training. We're talking
interval training, which we know, based on all the new research, that it is one of the fastest ways to bring in oxygen. You're bringing in so much oxygen. Your heart's pumping, moving the blood around. The newest research right now with cancer patients going through chemotherapy, that nothing that so far they researched would ever come close to helping a patient during chemo than exercise, high intensity, short duration. Why? Because when a patient is going through chemo, they have this chemotherapy through their blood. They need that chemo, number one, to get to the cancer cell, the tumor. Number two, they need that chemo out of their body as fast as possible. And exercise is one of those things that does that.
Well,
and so then the last is obviously toxicity, detoxing, cleansing the body on a regular basis, making sure the liver's working, making sure they're methylating and pulling all that out.
Yeah, now they can go to your website, beacancerkiller.com, and learn more about how to get your books and learn more about what you're actually doing and what you recommend. Am I correct?
Absolutely.
Well, just really amazing stuff, and we really appreciate taking time. So we've been talking with Dr. Charles Majors here, and this is aboutrealhealth.com, and your doctor has invited you to hear these amazing stories about people that have had huge health challenges and also huge health successes, and these are all based on making chiropractic part of that experience and doing the other things as far as your life to be able to really achieve that type of health. You want to speak to the doctor that invited you here and find out more about what they do so that you can refer your friends and family. Dr. Majors, anything you want to add before we close down the show?
Yeah, a lot of people say, that, I don't know if I want to get checked by the chiropractor. I don't know if I want to go in, and I'm doing pretty good. That's kind of the thing we always want to say is, I'm doing pretty good. What I don't know can't hurt me, and that's actually incorrect. What you don't know can kill you. So that means that if you're not getting the right testing done, not only from a doctor and doing blood work and all that, but actually your nervous system being checked. If there's even the slightest pressure or damage anywhere in the nervous system and that brain can't get to the body, that organ shuts down.
Absolutely fantastic stuff. We want to thank you for taking time out of your busy schedule. Make sure you visit Dr. Major's website, beacancerkiller.com. And on behalf of About Real Health, I'm Dr. Alan Weinstein, bringing you real health success stories. Remember, real health is possible. What we like to say is real health. Get serious about it. We'll look forward to seeing you in another month. Make sure you're here when we bring you one of our health experts sharing with you what you need to do in your life and your family's life to really be able to live the healthy life you're intended to. On behalf of myself, Dr. Charles Majors, we thank you for joining us today. We'll talk to you soon.